everybody, welcome back to the channel, and in this video I'll be discussing about ANUG classification. So do you know about ANUG? What is ANUG? It is acute necrotic ulcerative gingivitis. Okay, so typically this video is just concerned about the stages of the ANUG because it is less commonly asked, but it is very important if you need to write down a theory based question on the ANUG, because ANUG is very important topic, so you should know about this. And this classification is very underrated, so that's why I made it a separate video on the classification so that you can learn it. अगर हमारे पास सेपरेट एक वीडियो होता है उस चीज़ के ऊपर तो ज़्यादा लर्न होता है, हमें ज़्यादा बेटर समझ में आता है. तो बात कर रहे हैं ANUG की, तो मैं आपको वैसे भी बता देती हूँ कि व्हाट इज़ ANUG. और ANUG को आप और क्या बोल सकते हो, और भी बहुत सारे नाम होते हैं इसके जो लोगों को नहीं पता होते. इट इज़ ऑल्सो कॉल्ड एज ट्रेंच माउथ, इट इज़ ऑल्सो कॉल्ड दैट विंसेंट इन्फेक्शन. ओके, इट इज़ ऑल्सो कॉल्ड एज दिस विंसेंट स्टोमेटाइटिस, फेटेड स्टोमेटाइटिस and parotid stomatitis. Okay, so all these are the different names of ANUG, and it must be confusing to know all these names, but you have to know. And then important part is that very characteristic features. I will list some of the very characteristic few features so that it will be easy for you to identify it. It has punched out lesions, very important punched out lesions, as well as it has a crater like formations on the crust of the gingiva. There is pseudomembrane, which is the characteristic feature of it, and it is involving particularly interdental papillas as well as marginal gingiva. So interdental papillas and marginal gingiva is involved, but not the later parts of gingiva, that is attached gingiva, alveolar mucosa. These are not involved, just papillas and marginal gingiva. So these are the very few basic characteristic features if you find in a question, that you can mark it as ANUG. Now let's jump to the classification for which I have made this video. Now this classification is very important. It is given by Cohen and Honig, and it has 7 points. Okay, 7 points, very important. Now let me tell you first that the stage 1 is the most common one which is present in the patients. About 93%, or you can say 90% of the patients have stage 1. Okay, and then after stage 1, stage 3 is common, and then stage 2, and then stage 5. Stage 6 and 7 are least common, maybe 0% or 1%. So let's talk about the stages. Okay, so in the stage 1 you can see it is just tip involvement of the interdental papilla. So I have made I have made this papilla, and just involvement of the tip of the papilla is there in the stage 1. That is about 90% of the patients have this. Then in the second stage there is entire papilla is involved, that is stage 2. Then stage 3, in which the infection has occurred to marginal gingivitis. If you're new, fresh batch, and you are studying it for the very first time, I would like to make this diagram for you. Suppose these are the teeth, and I am trying to make you clear about different parts of gingiva so that it will be easier. Now, very important thing to know that this gingiva part, basically in between the teeth, you have called something papillas. Okay, so just to connect the teeth together in the proximal contact, we have papillas. So these are the papillas, okay. Now this thing is the marginal gingiva. Okay, this is the marginal gingiva. Then you have this free gingival groove. After this you're gonna have this so much area which is called as attached gingiva. After that attached gingiva, you're gonna have this area which is called as alveolar mucosa. So these are the basic parts of the gingiva that you should know, so that it will be easier for you to understand the classification now. So first of all, the papillas, tip involved, then entire papilla involved, then just margins involved, then this attached gingiva is involved, then only the buccal and the labial mucosas are involved. Okay, tooth, if this is the side view of the tooth of a mandibular central incisor, you can have a look. Just facial or buccal and labial, facial and buccal areas, like for the molars you can call it buccal, for the interiors you can call it labial. Just the buccal part or labial part is involved. Then you have the another stage 6, in which bone involvement is there. Bone, now the infection has occurred and reached up to the alveolar bone areas. After that, stage 7 is the one, like the infection after involving the bone has come outside of the oral cavity through the perforation of the cheek, so the perforation of the skin of the cheek. So these are the 7 classifications, 7 stages of the ANUG, which you should know if you are having a question on ANUG, or sometimes it is asked in your competitive exams also. So I think this is the best thing, like you can have a question on ANUG which is difficult, that is classification. So they can ask you what is class 3, what is class 4, and in which class you are going to have attached gingiva involvement, that is class 4, in which one you're going to have marginal gingiva involvement, that is class 3, which one have the just tip, that is class 1. So I think this video is helpful, and for more content to follow dental school, because it really motivates me to make more and more videos for you. Thank you.